my name is Rosette Farrow, and in this presentation, I will discuss the use of nanotechnology and the diagnosis and the treatment of cancer in the past, the present, and the future. So first, let's talk about where it all started. Dr. Feynman had his lecture in 1959 called There's Plenty of Room at the Bottom. He talked about um, making nanoscale machines and arranging atoms however we want to. And he said that his friend, Dr. Hibbs, talked about this weird possibility of comparing nanoparticles as to swallowing a doctor or a little surgical robot. So it sounded like a science fiction back then, but little did they know that it would be a reality 50 years later. So what is nanotechnology and how is it used? It is used to manipulate almost any properties at the nanoscale. Usually the size, structures that are the size of human hair. So it's very, very tiny. In medicine, these nanoparticles are used to deliver drugs, light, heat, and other substances to specific cells, such as cancer cells, which is what I'm going to talk about. Um, And now let's talk about how it was used in the past. In 2003, doctors Hallas and West won the Best Discovery Award by creating this very tiny nanoshells that is injected in your bloodstream. Once it's injected in your bloodstream, they will shine this light over your body for a few seconds, and that will then locate any tumors, its shape, size, location, and after that, they will use the same light to try to get rid of your tumor by using a higher energy. This procedure is very precise when it comes to keeping the surrounding tissues very safe and also very quick. And a year later, the National Cancer Institute established the Alliance for Nanotechnology in Cancer, which had phenomenal researchers. One of them was Dr. Rolf Weissleder. He created this portable device that was able to detect cancer from human biopsy samples. This device was handheld. It worked with nanoparticles, smartphones, and the results from this device were 96% accurate. And it took less than an hour compared to 3 days. So big advancement. And in 2011, doctors Emiji and Duan and their team was granted $2 million by the National Cancer Institute to design something that targets multi-drug resistant tumors. They were able to kill drug-resistant tumor cells without exposing the patient to too many drugs, which is of course harmful to your body. And these drugs also held on to those tumor cells a little longer, so frequent patient dosing is not involved. Also in 2013, Dr. Christoph Gerber and Dr. Rimaldi developed this microscopic cantilever to detect mutations in the BRAF gene. And in the slide, it shows you the difference between a normal one and a mutated one to help you better understand how the microcantilever works. So let's see, in this picture, there's 3 cantilevers. Um, the one that's bending has prostate cancer markers, so they use this laser beam to show mutated BRAF genes, which is pretty cool. And now we are moving on to the present where we use nanostars. You can see they're star-shaped, hence the name nanostars, and they're wider, so it makes them they kill cancer cells faster. Also, people has always been concerned about the toxicity of when it comes to nanotechnology. So Dr. Webster had this bright idea of using selenium, which is a natural material that can kill cancer cells and kill bacteria at the same time and not have any toxicity problems, which you might see with antibacterials like silver. So it's comparable to natural materials such as titanium for hip implants, silicone for breast implants, and so on. Um, and also, his team, um, they're working on putting nano features in these natural materials to prevent cancer from coming back. So I'm sure you'll see that in the future. You can see I have the stats right here to show you that um, nanotechnology has a very promising future advancements. Okay, thank you for taking the time to watch my presentation, and I hope your finals are not as hard as this one, and good luck.